To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today I'm joined by Dr. Kevin Campbell of OSI, and we are talking hip surgery. Welcome, doctor.
Thank you. Thank you for having me.
Well, I think the big thing, we'll get a little technical today, but the big thing we want to know is the anterior hip replacement. How is that different than all the other approaches out there?
That's a great question. Anterior hip replacement is a procedure where you perform surgery through the front part of the hip rather than the side or the back. And so we use a natural window between muscles in the front part of the hip rather than cutting them and detaching them like what is done in a more traditional approach through the side or the back.
So if I am somebody that's going to do this, kind of walk us through what that surgery looks like from a patient perspective.
Yeah. So I meet patients in the office, make sure that they have the right symptoms for having hip replacement surgery. The day of surgery itself is something that is relatively straightforward. You come in the morning, you have surgery, you recover for a few hours at our surgery center, and then you're actually able to transition home that same day.
Yeah, that's kind of crazy if you think about it. But does the anterior hip give you a better option because it's a better recovery time?
Yeah. I think anterior hip replacement offers many benefits. The first being that because we go through that natural window in the front part of the hip, we're not having to cut muscles, detach them from where they attach on the bones, and then repair them afterwards. Typically that means a quicker recovery, less pain, less chance of something bad happening after surgery, and patients are very excited to be able to go home and continue their recovery at home on the same day as their surgery.
Yeah, it's amazing how far we've come. All right, so we're talking to people who kind of know they probably need surgery, right?
Yeah.
So of the hip surgery, what makes somebody an ideal candidate for the anterior hip?
I think most patients who have arthritis and have wear and tear pain in the front part of the hip with their activities qualify for the anterior hip replacement. There's really no extenuating circumstances that require someone to have the side or the back. It's really just based on the surgeon's familiarity with doing surgery through the front part. So anyone who's been told that they have hip arthritis and need surgery, they're a candidate for the anterior approach.
And the beauty part about this is you folks over at Orthopedic Sports Medicine, the Fox Valley, you've done so many of them.
Yeah, we have a great team that's very comfortable with helping patients recover quickly. I'm fellowship trained in knee and hip replacement, so I think patients are in good hands and it will be a safe, comfortable experience for them.
All right, Dr. Campbell, thanks so much for joining us, and we want to thank you for watching To Your Health.